I hope you agree that Dr. Felitti deserves the Nobel Prize in Medicine. He has done more to improve healthcare than perhaps almost anybody. He's changed the whole paradigm from the biomedical assessment and treatment to the biopsychosocial assessment and treatment. Amazing. And I've had the great fortune of participating in the treatment solution side of the ACE study since before it even started and for decades after, right up until today. We're still collaborating all the time, and he's amazing. As a person, as a doctor, as a researcher, as a listener. He has great psychological skills, great communication skills, amazing writing skills, and he cares. He cares deeply. Yes, he's extraordinary. Now, don't think that everybody was in favor of what he was doing, the assessments, the questions. Many of the doctors said, no, we don't want to ask questions about people's lives 10, 20, 30, 40, or 50 years ago. And even if we do, when we find out about trauma and abuse and difficulties, from sexual abuse to suicide, to alcoholism, to mental illness, incarceration, what do we do about it? And they would say, if I wanted to be a shrink, I would have. We don't know what to do, so we're not going to ask the questions. That was more people than you think. And yet what we found was that when people had the opportunity to answer the difficult questions that nobody had ever asked them, they started to feel better, especially when we added that unconditional acceptance and listening and some very simple mind-body, self-care, self-healing techniques. So simple. And the doctors would say, well, won't everybody need therapy? And it turned out very few people did. If they did, there were 2 psychologists on staff, right there on the staff, doing groups, doing individual work, Robin, Lee, so they could handle that. But most people didn't. Most people found they could improve their lives dramatically by answering the questions, having that acceptance. That makes a big difference when you're sharing things that you've been ashamed of and hiding for decades and many years, to feel accepted. The person still wants to see you again. Yes, whether it was me or him or one of the other people, the nurses. A lot of people got training in this. So yes, it can make a world of difference. And now we've taken all these techniques from these 35 years and tens of thousands of people, and we put them into the app, which you know about. You can get it at True Sage. Self-healing, self-care. And for the people that still do need therapy, they see a psychologist. We make the referral. Yes. But most haven't, most didn't, most don't. But no matter what, everything's available. Right there at the click of a button, 24 hours a day, whether it's to learn the skills and the techniques or speak to a person. Connect with one of the experts, one of the psychologists or social workers, or one of the other experts, the psychiatrists, the physicians. So yes, Dr. Felitti deserves the Nobel Prize in Medicine. Learn more about it, Google it. Google adverse childhood experiences, Google Vincent J. Felitti, MD, and you will get so many citations, so many studies from all around the world. You'll be very impressed. Yes. So thank you for your openness, and we hope to connect with you soon.